Dear all, my name is Syed Tabish Razizadeh, and I've been asked to provide this short couple of minutes video to first introduce myself, my professional background, education and professional standing, and then make a comment about the recent initiative that has been led by Irfan Motala from UK. So what I will do, I will divide this brief talk into two separate sections. The first section will outline who I am as a pharmacist, and the second section will be what do I think we should do and how I can contribute towards this initiative led by Irfan. So, just to give you guys a brief introduction for those who are especially not aware of me, is I did my B Farm from Karachi University in 1998. I was the gold medalist for my batch, and following that, I chose to do an intern training program at Aga Khan University Hospital. Following my completion of the intern training program, I started working as a hospital pharmacist with um, clinical responsibility in an ICU team within infectious disease consultant, while operational responsibility as looking after medicine and later on pediatric ward. I went to Malaysia to do a Masters of Clinical Pharmacy in University of Science Malaysia after 1.5 years of my starting at the Aga Khan University Hospital. After that, I returned to Aga Khan University Hospital and established the first formal clinical pharmacy services at the hospital. I also managed to publish this in American Journal of Health System Pharmacy, and that's how I managed to introduce what we are doing in Aga Khan University Hospital to the world. And as a result, I received a lot of comments from pharmacists working in United States as well as abroad to offer some sort of engagement. And I'm going to refer this to the second section of this talk, that there is such a huge interest in contributing towards the profession of pharmacy in Pakistan from those pharmacists who are settled abroad, including the team that is being led by Irfan. After finishing Aga Khan University Hospital for 18 months, I decided to move to Saudi Arabia because of family reasons. Um, and within 1.5 years of working in Saudi Arabia, I did some quality initiatives, published a couple of papers, and got a scholarship to do a Doctor of Philosophy in Pharmacy Practice from Monash University, funded by Australian government and Monash University. I completed my PhD in decision support system and infectious diseases, especially with related to antimicrobial stewardship initiative in public hospitals of Melbourne. And later on, during that process, I also registered myself as a pharmacist and started working in one of the Melbourne-based hospital as a critical care pharmacist and oncology pharmacist for about 2.5 years. During that time, I also worked as an acting deputy director of clinical services for 18 months, and later on chose to stay into advanced practice portfolio instead of management portfolio that I really don't prefer that much because of my research and clinical interest. I'm also an American board certified pharmacotherapy specialist from 2011 onwards. And I am basically one of the 15 or 16 pharmacists in Australia who held these registration. The purpose of this brief description is to give you where I am coming from. At the moment, I am 2 years ago, I've decided to go into clinical academic role. So I'm looking after postgraduate clinical pharmacy program at the University of Tasmania. And I'm also a clinical pharmacy tutor at the Royal Hobart Hospital, which is the main tertiary hospital in Tasmania. So just to give you this brief introduction, I would like to go to the second part of my talk where I would like to just give you a brief understanding of what I think it's needed from from an experience that I've seen working in different healthcare systems. And what I believe we need is a coordinated approach. So we do need a public awareness. We do need um, working at our new graduates as well as people who are already in the practice. But apart from that, what we really need is a coordinated approach, including awareness, education, uh, research, as well as demonstration of this pharmacist-led values. For example, if you think about the way American pharmacy practice has evolved, is not because there is a special interest in pharmacy, or pharmacy is somehow magically become so specialized that it is a preferred profession for example, running asthma clinic or running heart failure clinic. I can still recall the clinical trial that I have studied when I was working as an intern pharmacist at the Aga Khan University Hospital, which is 1999. And that was about a randomized controlled trial of including pharmacists in the management of heart failure patients. Uh, and that give an evidence that compared to routine care, when you involve pharmacists in management of a chronic diseases which is widely prevalent in society, you can lead to better outcome. You can lead to cost saving, you can lead to better quality of care for patient, you can lead to better utilization of people resources. Without that kind of evidence, you are unable to convince general public, you are unable to convince decision maker, you are unable to convince your own profession that you have a role to play. Now, I'm not suggesting to transplant a US system into Pakistan, because uh, we I think we need to work at a grassroots level. At the hospital level, we are having pocket of excellence, like pharmacy involvement in hospital is quietly varied between hospital, but it is at least has grown over time, mainly because there was this desire for pharmacists to do more than doing marketing and sales, and that's how it naturally progressed from one part to another. And there are leaders like Latif Sheikh from Aga Khan University Hospital, Mr. Maqbool from Liaquat National, Nasir Sahab from Liaquat National, that also establish few services. So it evolves because there was a need. In community pharmacy, we need to be very careful that it is always a business. So this is a business model. You are dealing with not only the healthcare factors. You are not dealing with only the government organization. You are dealing with access to medicine to public. So, for example, those I can't even remember the name. I think it was Hanif Ballo or Billo, guy who was the Chemists and Druggists Union representative, and he often threatened when we were in early stages in Karachi that they are going to boycott, they are going to stop the drugstore. So imagine if something like that happened, you're going to create a chaos, and you're going to create a message, you're going to send a message to the public that you don't care about access to medicine. So it's way more complicated because it's the community pharmacy. The good thing that we have with us is Irfan, and a lot of his colleagues are actually experienced community pharmacists. For example, Nadeem Zia Bhai from Canada, he's a community pharmacist as well as a hospital pharmacist. So he has a diverse experience. So we are working with people who are actively running community pharmacy. For example, Irfan, your batchmate, has a couple of pharmacies in South Australia. So he has a good understanding of community pharmacy business. Gibran is a very good community pharmacist in the team. So we have that critical mass to think about those things. What we need, and what my contribution that I hope will be in this group, is to give you guys an a robust analysis of how we should document the value of pharmacists. So how should we produce figure? For example, without mentioning any names, I'm marking another PhD thesis from Karachi University, and I've just recently marked one PhD thesis from Karachi University. And despite having a very good intention to do research, there is lack of understanding of how to do practice-based research, and this is because majority of research has always been done in lab sciences or in a laboratory settings. So when you move out of the laboratory and you start working in social pharmacy, clinical pharmacy, there are certain norms. There are certain norms of survey data. There are certain norms of case-based case control, retrospective cohort studies, prospective cohort studies, designing a trial. So these things are not as common in Pakistani academia as they are in other academic. So I think me and we have a colleague, Dr. Zahir Baba, who is the head of pharmacy practice in University of Auckland, will be an excellent resource to offer research-based services and to, of course, like as a team, and to give you some understanding of how you can inbuild the data collection. So whatever process you are doing, we need to look at me and those people who are interested in doing research with me to look at how we can evaluate it, how we can design a formative evaluation strategy of whatever you guys are planning to do, so that when you finish that uh, initial round of these things, you are able to quantify the improvement, and that will not only motivate the pharmacists who are at ground, it will also convince decision maker, and most importantly, it will convince the people who are working with you that whatever you are doing is making a difference. I'm happy to upload more documents. I'll send a link to my university profile so interested people can look at more. They can send me emails. We have a lot of interest from PhD students from Pakistan and Malaysia and India and these developing countries that we can design some project. We can work with Hamdard, Peshawar University. I met two colleagues from University of Peshawar in one of the pharmacoeconomic conference in Berlin. So I know few academics in Pakistan as well, and we can do a more supervised project with current students who wants to do master and PhD in those universities, and that will generate not only research output for us, but at the same time hard data that we can convince broader population. So when we are going to public, we are not just using sentimental advertisements. We are actually showing them the proof. We are showing them the objective evidence that how we can make a difference. So I suppose this is an excellent initiative, and I really admire that. It's not easy to run a business in Western countries. So Irfan running a business at the same time. Without any financial motives, looking at advancement of practice is something that is highly commendable. I really respect what you guys are doing. I would not have time to do this of my own or to initiate something like that, but I'm more than happy to offer my services. Time difference from Australia means that I can contribute to these things out of my job hours. I have to do this in morning because the equipment is already available here now, and I can do meetings and web conferences later on. At the evening when it's an evening time in Pakistan, I can do late night presentations if people are more likely to involved with me and they want to do more projects in order to do something nice. So thank you very much for listening to me.